Good evening, everyone. I hope you're doing well tonight. My name is Sarah Scalzo. I'm the director in the Office of Student Engagement. I know I have spoken to some of you at different sessions throughout this summer, and I want to welcome you to our final parent summer orientation webinar tonight, where we talk about health and safety. We've got a fantastic panel of folks to speak with you. And before we get started, I just want to share a couple of housekeeping notes for all of you. First of all, one of the things you may notice is that we use the word parent to really kind of be an overarching definition. So that could mean support person, guardian, grandparent, however you want to define that role. We're just going to broadly use the phrase parent. The next thing is you will have an opportunity throughout this presentation to ask any questions that you would like. No one else will see the questions you're asking except for the panelists. We're going to do our best to get to everything tonight, but we also recognize we may not get to it. We may not get to the depth to what you want to discuss tonight. So we're going to do our best to give you some broad strokes. At the end of the presentation, if your question didn't get answered, I'll talk a little bit more about how we'll be in touch with that and where you can find out additional information. Some of you did share questions with us ahead of time, and we are going to do our best again to address those as we go. And we're going to kind of keep track of that throughout tonight. So the first thing I want to do is make sure you know a little bit about who our panelists are this evening. And then from there, we will get started with our presentation. So Adrian, do you want to introduce yourself first?
Yes, hello everyone. Welcome to Loyola. My name is Adrian Black. I'm the Director of Public Safety here.
Wonderful. Jason. Jason, you're on mute. Infamous.
So sorry, I was trying to use the space bar. That wasn't working. I'm known as the resident boomer around here. My name is Jason Parkover, and I'm here in my capacity as the director of the Counseling Center. But more importantly, I'm also here as a fellow parent. I can't believe I'm finally saying this, but I have a child who is starting college this year as well. So I can very much empathize with where you all are right now and getting prepared to start a wonderful year. I'm looking forward to getting to know you and sharing more about our mental health services at Loyola.
Wonderful. Julie.
Hi, everyone. My name is Julie Sands. I'm the Director of Student Health here at Loyola.
And Joan.
Good evening, everyone. We're so glad you could join us this evening. I am Joan Flynn. I'm the Associate Vice President for External Affairs and Emergency Management.
Wonderful. Thank you. Thank you all. And again, I will share right now, the session is being recorded. So if there's something you missed, you'll have the opportunity to go back and listen to it. So we'll have our friends in Event Services forward the slide, and then Adrian, our Director of Public Safety, will start us out.
Well, again, welcome. So I'm going to talk to you a little bit about the services we offer so you're aware of what environment your students walking into. Next slide. So public safety is responsible for the security operations on our campus. So we're partnered with the city police to provide 24/7 security. We patrol all of the grounds and the buildings. Throughout the day, holidays, weekends, we're always there. There are 800 plus cameras that we use for virtual patrols. So if you don't see a physical patrol person there, we are watching by camera. We also have emergency blue light towers with phones. If you need help or a student needs help, you just push a button, it puts you in direct contact with our dispatch center. Students will also be offered the Live Safe mobile security app, which is something that we offer because it's a robust suite of security applications that they can carry on their mobile devices. If they need help, they need to contact us, they just want to take a picture and send it to us, or even report something anonymously, Live Safe is there for them. So I highly recommend that they use it. And you can download it using the link on our website, the public safety website. We also have a system here, Greyhound alerts, and we use that to send out emergency notifications if there's anything going on that may pose a threat or a challenge to our campus. So one of the things I say here is to always look out for the Greyhound alert if something is going on that we cannot contain, and try not to get your information from social media. There are multiple apps out there where people can report things they see. There's Citizen app, and I think there may be some new ones popping up, but always get your information from us. And that is because we have the vetted facts, the information that of what's actually going on campus or close to campus. I did get a question about some of the security in the buildings. So we do have card reader controlled access buildings. To get into any res hall, you're going to have an access card. One of the things that your students will hear during their orientation is not to share their cards. If a friend loses a card, have them come and get a new card. Do not pass cards around. And also something that I call piggybacking, which is something if somebody swipes in and then lets 10 other people in behind them, they've just breached one of our primary security measures. So we ask them to really keep track of that ID card, only use it for their purposes. We also have medical and security escort services that I'll talk about a little in my last slide. And for anyone that wants to report suspicious activity, a crime in progress, anything they need assistance, the number on campus is 5911. That's the last four. So it's basically 911 with a 5 in front of it. Next slide. So some of the tips your students will hear if they're off campus, to always be aware of their surroundings. One of my pet peeves is walking around with iPods or headphones, because they can be distracting, or face buried in a mobile phone while they're walking. Always be aware of your surroundings. This is a big city. It's no different than any other big city. We just want them to be aware. If they're off campus and something's going on, they should dial 911 and then notify us too. So it's a dual notification. Call 911 and call us so that we can bring university resources in as well. Because again, we partner with fire, EMS, police, and everything else in the city. So it's important to bring us into the picture. Next slide. On campus, same thing. If they see anything, report it. And they can report it with the LiveSafe app, at any of the blue lights, via phone, the 5911. We depend on students to report suspicious activity because there are more of them than there are of us. And we're all part of the same community. It's a joint effort to keep our campus safe. And to toot our horn a little bit, the statistics show that we do have a very safe campus. There was a question that I'm just going to jump off and answer. There was a question about robberies on campus that were reported in social media. For the past 3 years, there have been, 2018, 2019, there have been no robberies on our campus. What you may have heard about are things that occurred off campus or close by, but not on our campus. And again, our annual report is available online. You can see what the statistics show for the previous year. So let me jump back into my slides. So something we ask is to make sure that doors are locked and keep building doors shut. We really push the idea that they not prop doors open. Even during move-in, don't prop doors open, because again, that breaches our security, which is the access control. Students should always carry their keys and report them lost or stolen at any, immediately if that happens. And again, do not let strangers into their buildings, because that breaches our security and that bypasses our access control. Swipe guests into buildings at the desk. And that was another question that I received. In all of the first year student res halls, there is a desk in the lobby, and it is monitored with CCTV. And we do have it under surveillance 24/7. And all perimeter doors are swipe access only. Again, and keep valuables in secure locations. And we're all part of the same community. Loyola police work for the university, so be cordial in their interactions with the police. That's something we do ask. They'll see some of the police probably in some of their classes. We have police officers with family here, so we're all part of the same community. Next slide. Something that your students will hear during their orientation is how to evacuate, how to shelter in place, and how to survive an active threat. And these are the three, I call these the big three, because these are things we want them to know on campus. If a building alarm goes off, we want them to leave the building immediately. We don't want them to second guess it or think it's a prank or false alarm, we want them to leave and then let us come in and verify it. If I send out a Greyhound alert to shelter in place, all that means is they need to get into the nearest building and use that building for protection of whatever's going on outside. Surviving an active threat, we teach them how to run, hide, or fight. And there's more on that on our website if you're interested. There's actually a link with a video that actually shows you some of the training. And something we do ask as members of the Greyhound community, help each other. So if there's someone with a functional need, we ask that they help them evacuate. Next slide. About 2/3 of all fire alarm activations on campus are caused by cooking. Okay, people are burning food. Some other common causes, steam, excuse me, steam from showers, smoking, and this is a smoke-free campus, or storing flammable items in drawers under stoves, to dry them or whatever that may be. But we do ask to be mindful if somebody's cooking so that we don't have these alarm activations. Next slide. Something I wanted to talk about, because I do get a lot of questions about this, is our escort service. And because we were dealing with the worst of the pandemic last year, our escorts are primarily for medical or security related requests. And the priority is given for COVID transports. So there's no guarantee if we are called for a transport that we will have a vehicle available. But if somebody has a security concern, an officer may arrive, but they may just walk with the person to their car or from point A to point B. They might be on a bike. It may not be in a vehicle. But we do not transport off campus. And if you are in one of our vehicles for whatever reason, we ask that a mask be worn at all times. That's the majority of my presentation. Are there any other questions that I can answer?
I will say that the chat box is open, or the Q&A is open. So if you do have questions, we will ask some of our presenters at the end. So Adrian, hang tight. We'll probably send more questions your way, but we will move on to Jason.
Thank you.
Hi folks, it's Jason again. Look at me, I have my mute off properly this time. Want to tell you a little bit about the counseling center. Our contact info is on the slide that you can see, and wanted to let you know about our 24-hour emergency line for mental health emergencies. Is that 5530 number. Next slide, please. I can give you all the convoluted directions on how to find us in the back of humanities across from the lacrosse field, or I can just tell you we're across from Starbucks, which is pretty much how everyone knows how to find us. Our services are free and confidential. Next slide, please, Scott. We have a really talented team of doctoral level and master's level clinicians who specialize in mental health care of college students. Just a wonderful team who cares deeply about the work that we do. And you can learn more about the staff on our website. Next slide, please. And we address all sorts of emotional, psychological concerns, anything that really you could imagine. Anxiety is by far the #1 presenting issue that we see, but lots of, homesickness, relationships, some depression, identity-based trauma, self-esteem, et cetera, et cetera. Next slide, please. And we will this fall be offering both in-person and telehealth services based on primarily on student preference. And our services are really tailored to fit the needs of each student. We're not set up to be like a community mental health center, right? Students aren't going to be able to come and stay in therapy for 4 years with us. no college counseling centers are set up that way, but we have a really dynamic, effective set of services that meets the vast majority of student needs right on campus. So students can choose to come in initially for a Let's Talk single session. And this is, you don't have to become a client. Maybe you just want to do some problem solving. Maybe you just want some really brief support. They can get signed up for that, or they can choose to come in for a fuller assessment where we spend a couple of sessions really getting to know what are they looking for, what's their background, and then we help make decisions about what type of services are going to be most helpful. Next slide, please, Scott. We have this wonderful range of workshops that are available to all of our students. It really strategy-based, coping-based approaches to growing and living an effective life. And research shows that workshops and group counseling are really effective, especially for this age group, where having a sense of connection and sense of belonging is so important. So on the next slide, we can look at some of the groups that we offer at Loyola. We have a few more than these as well, which you can learn about on our website. So we have Let's Talk, we have workshops and group counseling. And then on the next slide, a description of our brief individual counseling. And so this is when students are wanting or needing to connect one-on-one with a therapist. Generally, these meetings will happen either once a week or every other week. We usually can get folks in within 4 or 5 days to meet with someone, which if you've tried to get a therapist, you know, in the larger world recently, you'll know is really fantastic, because most folks out in private practice do take a while to be able to get folks in. And if you're wanting more than, or your student is maybe needed some more open-ended therapy, say they've been in therapy for a few years and they know it's just part of good self-care for them, and they want to build it in across the span of their college education. If we could look at the next slide, Scott. We have a wonderful referral, comprehensive referral support system. And the way that works is we have a network of folks that we know right near campus who are wonderful practitioners. We know what insurance they take. We know how to help students get there if it's going to be in person. And so if someone is interested, or we're recommending more open-ended therapy, we're going to spend several meetings with them, talking about their options, making sure they're really connecting with someone who's a good fit, and inviting students to come back if it's not a good fit or anything changes, to let us know that our doors will always be open to them. And so one of the points that I really want to stress is, if your student has been in therapy for a while and you know that they're going to have more ongoing needs, please feel free to give us a call, even as soon as tomorrow, before your student arrives. Talk through with us what you think your student may be needing. We can brainstorm with you and help get that set up so that the support is available right from the get-go. Give us a call even if you're not sure and you just want to talk over the options. Okay. On the next slide, I wanted to highlight one of our many online resources. When you get a chance, check out loyola.edu/counseling center. We get over 12,000 visits a month. And I think that's because we have some really incredible online resources, relaxation, meditation resources. One of our new offerings, which is free for students, is called Together All. It's a 24/7 24/7 online digital peer-to-peer support program that is moderated and monitored by a professional counselor. They know that one of us is on board to help with anything that comes up, but the main gist of it is for students to be able to gather sort of digitally and seek support at any time of the day or night. So we're really excited to be offering that. Next slide, please, Scott. Maybe your child is someone who still feels a little bit cautious about coming into the counseling center. We do a lot of work out on our campus community. We go to Messina classes, we go to orientation. They'll get all of this information at their own orientation. We do public health work. So we want to be out on campus. So they're meeting us and learning about ways to take good care of themselves, even if they're not coming in for counseling services. So keep an eye out for our public health work. Similarly, on the next slide, I just wanted to highlight that we're a staff that is very invested in social justice and advocacy. There's more than one pandemic going on in the world right now, and we want our students of all backgrounds and all intersecting identities to feel safe and to know that we're a place that can help them get support and get connected no matter what's going on in their life. And speaking of support, on the next slide, wanted to let you all know that we're here to support you as well, not to do therapy, obviously, but to consult with you. If you're concerned, if you're seeing things in your student, changes in their behavior or hygiene, or they just don't see themselves and you're not sure what to do, give us a call. We consult with faculty, we consult with student leaders, and we're very happy to consult with you. We'd much rather work with someone before the problems get too big and sort of snowball. So keep us in mind for that. If you're interested in doing an online training that all faculty and staff at Loyola do and student leaders, check out Cognito. It's a great online training about how to support your folks in your life that you're concerned about. And finally, I wanted to invite you to, again, check out our website, follow us on Instagram, because we have a lot of great resources there. One of the things on the website, we don't have time to go into it too much now, but on the next slide, please, Scott, we have some wonderful pages on how to feel supported and cope with emerging. Hopefully we're emerging now from the pandemic. I know things are a little bit dicey again, but it's a tough transition, and we have lots of great ideas. We're here to support students through that transition. So please check out those resources as well. And then flipping to the next slide, we're really excited to meet your students. And if you're ever on campus and want to pop in and check out our facilities, please feel free to. And just want to wish you all a really wonderful and successful start to the year. Thank you very much. And I think I'm turning it over to Julie, yes?
Yes, that's me, Jason. Awesome. Thank you so much. My name is Julie Sands. I am the Director of Student Health here at Loyola. I came to Loyola because why not, in the middle of a pandemic in September of 2020. I have a background in college health. So I've worked in college health for over 10 years as a nurse practitioner, and just sought out this position at Loyola because it was the place that I truly wanted to come to. I want all of you to understand how well supported we really do try to make your students feel, and understand that these services are not just us talking to you today, but they really do carry through the years. Next slide. So Student Health Services, we are located on what we call West Campus, which is the area, if you're driving south on Charles Street towards the city, we're on the right as you pass under the bridge. We do have hours from Monday through Friday from 8:30 a.m. to 5 p.m. And we are located in Seton Court. Next slide. We do a lot of work in regards to our students and keeping the campus safe and healthy. I threw this in here because we were all very excited to get our vaccines back in January as soon as we became eligible. We are continuing student health services no matter if there is a mask mandate in the city. Student health services will be a mask required office this semester. So anytime your student comes to see us, of course, we'll remind them when they're on the phone with us ahead of time, but we do ask that students and faculty, staff, and administrators all wear masks while in the office. To best assist your student really this semester, we ask that you call for an appointment. Many times previous to COVID pandemic starting, we were able to accommodate a walk-in here and there, but we really need to have a conversation with students ahead of them coming in so we know best how to treat what's ailing them. So if they're having some things, we may meet them outside, do a COVID test. If we have other things that they're working through, we may bring them into the office and they can see one of our providers face to face. We also will be doing telehealth as well, just like the counseling center. So we have a wide array of ways that people can seek our services this semester, and it worked very well last semester. We do have a COVID symptom tracker for our students to complete. They'll get more information about that and how to log on and do that. We are asking students to do it daily. And in the office, we do have rapid COVID tests, and we do have the ability to send PCR or the longer COVID test. Usually gets back to us within 24 to 48 hours. And the symptomatic students, depending on their symptoms, can even qualify for a COVID and flu test all in one swab. So that's really nice. That's something new that we've been able to add since the pandemic, or actually since last semester. I did see a question pop up previous to the chat tonight, basically asking about booster doses of vaccine. We do work very closely with the Maryland Department of Health and the Baltimore City Health Department. We also have a partnership with Giant Pharmacy where we will be able to get booster doses of vaccine if that's what the CDC authorizes to do. So we will not be doing that ahead of any announcement from the CDC and federal bodies that have been guiding all of us. But when and if that does happen, we will work very quickly and to get shots into arms as needed. Next slide. Just a little bit more about what we do on campus. We do examine, diagnose, and treat sick students. Our clinical staff, we have physicians, we have nurse practitioners, we have an RN and a medical assistant. In Maryland, something different than other states, nurse practitioners have full authorization for prescribing. And so we have all gone through extensive training and are basically a mid-level provider that can do everything from examine, evaluate, and treat and diagnose. We work very closely with home physicians. So primary care doctors at home, specialists at home, we can easily work with your physicians at home to help students be able to continue their care here at Loyola. We offer systems where if students require blood draws every so often due to a requirement from a physician from home, we can help with that. And if we need to refer someone to see a specialist here in Baltimore, we have a wealth of medical providers and fabulous medical care in Baltimore here right at our fingertips that we work very closely with. We do offer vaccines in our office for a fee. Some of those would be the flu or meningitis vaccine. The COVID vaccine, of course, is free to anyone right now, for now. And we do a lot of campus outreach. A few years before I came, they started the Smoke-Free Campus campaign and we became smoke-free at Loyola. Smoke-free does include vaping. It's right there. So no vaping and no smoking on Loyola's campuses. And go ahead and advance, please. Thank you. So we manage a lot of the student needs, our acute care and urgent problem visits, everything from coughs, colds, flu, which used to be, you know, pretty run of the mill and now can be a little bit longer to work through what the actual cause of things are. We see a lot of that. We do some gynecological concerns. We do not actually do well woman exams, but we do UTIs and STDs and all the sort of things like muscle strains, injuries, and skincare concerns. So one thing I will say is that our services, we have allergy clinics that our physician and our RN run. And like I said before, we have the ability to do labs in-house. We can do COVID testing, flu testing, strep testing, mono testing in-house, and then we can send blood work as well as other labs out to local labs. We also have an in-house pharmacy with about 30 medicines, prescription medicines that we can prescribe to students. While the visits for all of our services are free to our undergraduate students, the medicines, if we were to prescribe something or a test that we might do, is billed to the student's account, and they can pay that. They pay that rate when they're leaving the office. Next slide. I'm just going to talk a little bit about our social media and then tell you a couple more things real quick. So we are very active on social media. Please follow us at Loyola Maryland Health. Once the students come back, you will see posts on there all the time about what we're offering, flu shot clinic dates. We do have flu shot clinics set up for the fall, which, because the flu shot will be something all of our students need to get this year. I do want to let you know that we, after hours, do have an answering service. So we have, if students call and need to speak to someone after hours because of a healthcare emergency or an urgent matter, they call an answering service, and a physician from LifeBridge Health will give them a call back, just like you would call your physician or pediatrician at home in the middle of the night. It's the same type of service. We do take health insurance for flu vaccines through our partnership with Giant Pharmacy. So I did see that some people do have health insurance covering their flu vaccine, which is great. We would recommend that they come to our clinics on campus, one in September and one in October. We'll be certainly pushing those dates out to our students as soon as they get on campus, and Giant Pharmacy will be able to charge the health insurance, so there's no fee to the student. I think I'm gonna go ahead and pass it on to Joe now.
Okay. Thank you, Julie. Good evening again, everyone. I hope that this has been and will continue to be a helpful session. I have been involved with the planning of reopening a university in the era of a global pandemic since March of 2020, and most recently chairing the rapid response team on campus. And that's a group of administrators from all divisions of our university who meet on a daily basis to review and assess whatever is going on that day, on any given day. And so we've been meeting in that manner since January of 2021 and continue to do so, and will continue to do so through this academic year, because as we all know, this is an ever-changing pandemic and virus. And so it does keep us on our toes. Part of the work that we do is monitoring the CDC, the ACHA, which is the American College Health Association, best practices at other universities and colleges, city requirements, state requirements. And we also have a team of medical experts. Julie referenced Sinai Hospital, which is a part of LifeBridge Health, but we have medical experts with whom we work at other institutions. And so we are working diligently to make sure that this is a positive, safe experience for your children and for you as members of our greater community. I noticed in the questions that were posed before the session this evening, there were a number about masks and mask requirements. And as luck would have it today, our mayor, the mayor of Baltimore City, Mayor Brandon Scott, actually reinstated an indoor mask mandate. So moving forward, All community members and all visitors at all of our campuses will be required to mask indoors. Now, by that I mean if you are in spaces like dining halls, classrooms, fitness centers, what your sons and daughters do within their own residence halls, that's sort of their own pod, similar to what their family would be at home. This is their family now at Loyola. Certainly they're welcome to unmask in their own residence halls, but we will have that requirement in offices and other locations as well. And we will continue to follow those guidelines as they change, and as I imagine, they will change. We're not requiring an outdoor mask mandate, but certainly if your sons and daughters feel most comfortable wearing a mask in any setting, we want them to do that. We have shared that messaging with our entire community, our faculty, staff, and administrators. We want people to feel safe and to feel comfortable while whether they're matriculating or living or working here at Loyola, because that's who we are as a Jesuit institution. And the folks that you've heard from this evening, I think have spoken very eloquently to that. And that is always our goal, is the care of our community. So I don't have a presentation like everyone else. That's probably a good thing. Try to keep this brief. Certainly if there are additional questions, we'd be happy to try to answer them. I think from my perspective and looking through the list of questions that were provided in advance, those are probably the ones that I can answer. Julie and Jason have answered a few others. But if there's something, Sarah, that you would like me to try to speak to in addition to this, I'd be happy to do so.
Great, thank you all. Yes, let me start with Adrian. I know I had sent you a handful of questions kind of at the top of the session after you finished up. Do you want to answer some of those questions that we received in the chat?
Sure. So I have one. Let me just go back. Yeah, so one question is who basically drives the escort vehicles? So 9 times out of 10, it's going to be a public safety officer, and they're trained in basic CPR, CPR and basic first aid and AED. Sometimes we do have student drivers, we have student workers. So at times they'll drive the student escort van as well. There's another question. It says, do parents get alerts, the Greyhound alerts? The answer is yes. You just have to access it through the student's account. Just let them know that you're interested in also getting the alerts. If you have any issues with that, you can reach out to us direct and we'll help you manage the account. And there was another, about LiveSafe. My understanding is there might be an initiative to help with LiveSafe. And Sarah, you can speak on this, but if there are any outlying tech issues or anything like that, of course, we can be a resort as well. Did I get it?
Yes, I think you did. I think you did. So the LiveSafe app that Adrian's speaking about, we are going to work with students in one of their very first meetings with their evergreens in the fall to have them access and download the LiveSafe app. And then the next day, they will be in a session talking about community and safety on campus. And at that time, may have some more information that Adrian would share with the students to be able to answer their questions on how to navigate the app and just general campus safety. So wonderful. Let's see, Joan, there was a question that just came in about mask mandates in classes. Would you want to answer that?
Sure. Yes, based on current city guidelines as of today, students and faculty would be required to wear masks in classrooms. If there is a medical reason why that might be problematic for your child, I don't want to speak for Julie, but I think you would reach out to Student Health Services, have a discussion about that. But both the students and the faculty will be required to wear masks in our classrooms.
Wonderful. Thank you. And I'm curious from our panelists, do you have words of wisdom or advice for parents who are sending their students to campus, just in general, not just about necessarily the departments that you represent, but having spent the last year and a half at Loyola in a pandemic, what advice might you have for someone sending a student to campus?
I would offer the notion that we are all likely to see over these last few weeks while our students are home, a broad range of emotions that maybe seem to come out of nowhere, not necessarily connected to anything in particular, and that is completely normal, a function of the stress and anticipation and joy and of getting ready to go through this incredible transition, and also to name that I think you'll be really amazed as you see them come back, winter break, Thanksgiving, the type of growth that they're going through, and just be thinking ahead about how you want to help them transition back into being part of the household and how things may need to shift over time. It's a really exciting time, and for the students and for families, and just being able to talk through a lot of what we're feeling can be super helpful.
Maybe I could add to what Jason just shared. So much change, particularly for first year students, but so much change for all of our students and for us. But please know, we are in it with you. And you've heard from Jason and Julie and Adrian this evening about the many, many services, the wonderful services that Loyola offers. Please encourage your students to reach out, to not feel funny or uncomfortable or somehow they're the only ones that have this need, because that is not the case. And we are here to help, and we want to be able to do that and to, again, make this as positive experience as it can be for them during what is a challenging time. And also that things will change, as we've seen as a country over the last 18 months, and that will probably continue at least for a little bit with these new variants. But we are here to support you and to support your children. So all you have to do is ask.
Yeah, to add to that, I was going to say, Joan, definitely make sure that you encourage your students to reach out if they need help. I've worked in college health for 10 years and worked with so many students who said, if I had only come sooner. So really just reach out, encourage your students to reach out. If you're worried about them, reach out to us. We're here for you, and we want your students to succeed.
Wonderful. I'm not seeing any other questions come in on our chat. So so what I'm going to do is just kind of share some wrap-up question or wrap-up comments with all of you this evening. If you do have questions, I certainly pop them back in the Q&A, and we'll continue to go. But what I would want to say is often the question is kind of what's next? What should we expect? I think the first thing to remember is that we will continue to be in touch with you and your student as we get towards the move-in dates at the end of August, well, really early September this year. It's important, if you haven't heard me say it before, I'll say it again, that your student is checking their Loyola email on a regular basis. To me, that means daily. That is where all of the official communication from the university will be sent. And so if they are ever saying that they've missed messages or can't find something, please make sure they're checking that, not their Gmail or their Hotmail or Yahoo or whatever it is that they're using or had initially on record with the university. And with that, I will also just give a caveat. Last year, when we were getting ready to start our fall welcome weekend, an email went out about where students needed to go the very first day for their first online meeting. And we received at least 50 phone calls from parents in about 1 hour because their student couldn't find the email, and they were sure that we had not sent their student this particular email. But as soon as we asked, did they check their Loyola email? It was, oh, I don't know. So please let them know. We will not communicate officially with them through their Gmail. It's just not the way it works. What I will also share with you is what Fall Welcome Weekend will look like. Oftentimes parents want to know, is my kid going to hear the same thing that you've shared with us? And yes, we will be sharing very similar messages. We don't share it over the summer with them because we also know that it doesn't always seem real and it may not stick with them longer term. Like many on the panel, I've been at Loyola for a very long time. I've been doing orientation a long time. I kind of know, kind of the trends of things in terms of the student experience. So during Fall Welcome Weekend, we're going to cover topics ranging from safety on campus, community, academics, general expectations of your student as a member of our community. I think more importantly for some of the students, there will be social activities every single evening for them. They will never be bored. And I think that's important to note, especially because we know that your students, for the most part, have probably been online and virtual for the majority of the last year and a half. And so we know how important it is for them to connect with their peers. So we're offering opportunities for them to connect socially with one another. They will also be joining their Messina group really that very first day. And so these will be students that they will be able to connect with, not just throughout Welcome Weekend, but really every single week, usually twice a week through their Messina group. So there are really an awful lot of opportunities for students to connect. We'll have an activities fair the second week of the semester. So if you're worried about what they may or may not have done in high school or how we might help prepare them for their time at Loyola, my favorite phrase is trust the process. We put a lot of information out there. We offer a lot of programming for them. The catch is as a parent to please help them understand to take that step and take that leap and get involved. It can be scary at first, but their evergreen peer mentor will be with them every step of the way and happy to go with them. So just the last couple of housekeeping notes. As I mentioned at the top, we will have a recording of this available probably early next week on our orientation website. That's www.loyola.edu/orientation. Once that recording is available, I will send an email out to all of you to let you know that. And you are also welcome to go to that website and view any of the sessions that we had hosted earlier this summer. Everything was recorded and is available. If you do have questions at any point, you're not sure who to talk about, you missed someone's name, you're not sure who that really nice lady from the health center is, you can always send an email to us at at Loyola. My gosh, y'all, I've been doing too many of these. Our orientation email address is orientation@loyola.edu. Very simple, orientation@loyola.edu. My team and I will figure out who the best person is to answer your question, and we'll be sure to get that addressed as soon as we can. Otherwise, we thank you all for joining us this evening. We know that this topic is probably top of your mind as you get ready to transition to September with us. But again, we very much see you all as partners in your students' education and hope that you are able to reach out to us when you do have questions as the semester continues on. So with that, we thank you very much and enjoy the last few weeks before campus drop off, and we will see you in less than a month. Take care.